So our final session over here, entitled South-South Collaboration for Health and Development Goals. And it's my pleasure to invite my two panelists up here, Commissioner Amira Elfadil, who is the Commissioner of Social Affairs at the African Union, and Dr. Renu Swarup, who's the Secretary of the Department of Biotechnology in India. You'll recognize that my two panelists represent two different regions, please. And this is a tradition we've had in the transfer of our Grand Challenges meeting from one region to another, so from Africa to India. And this gives us the chance to talk about this Global South collaboration. So I've always believed that the Global South has got tremendous lessons to teach the world around many subjects, including manufacturing in many of its incarnations. Also, I believe that we are going to find some of the most interesting solutions to new ways of delivering healthcare at the primary healthcare level in the Global South, and those will be transferred to the world. So I wonder, Dr. Swarup, can I turn to you? You've been very much involved in evolving a very unique vaccine ecosystem that essentially supplies most of the vaccines to kids around the world. Maybe you could give us a sense in terms of the South-South collaboration. What can we in Africa learn from what you've done over these past years?
Thank you very much, Trevor, and a very good evening to all of you. Yes, I think you've really spoken about one of our most exciting journeys, and that is the journey of vaccine development, and not just development, manufacture, and delivery. This is a unique journey which all of us are very proud of, and it brings forth a number of key issues, which is a learning not just for other countries, but for us within India as well, when we look at many other newer areas. I think the excitement of this journey brings out very clearly one key principle which we all talk about, taking innovations further, and that's the principle of public-private partnership. Our whole journey of vaccine development and manufacture, as you said, where we stand today over so many years, has got a very strong base in the public-private partnership. Today, rightly said, India supplies vaccines not just for its own immunization program, but yes, across the world, and probably every third child is getting a vaccine manufactured in India. That's the strength which the industry has been able to build in. We have many interesting examples on this, and one of our most recent example, which is a success story of a public-private partnership, is the rotavirus vaccine, which was a wonderful partnership with the foundation, with NIH, and many others, and within the country, the academia and the industry taking it forward. It's a true example of something which began as an academic research by Dr. Bhan, who had initiated it with a whole team of researchers, taken forward through this partnership, through our manufacture with the Bharat Biotech, and today it's being across mostly all states within the country in our immunization program. This also tells us two other very important things, that the government has to be a key enabler, and the key enabler not just to promote the innovation ecosystem, to promote the public-private partnership, but also to be an enabler for policies which allow this to move forward. Also, the vaccine is one in which the government is also one of the buyers in terms of the market access. So that also makes it a very important drive for the vaccine development to move forward. And as I said, in addition to the public-private academic partnerships, the international partnerships that we've had, we have been guided over the last 30 years through a very successful partnership with the NIH, and that's the Indo-US Vaccine Action Program, which actually helps us to take forward many vaccine development activities that we support, the foundations programs that we have. We have now recently joined the partnership with CEPI, and we are looking at new vaccine development. We've launched the IND-CEPI, which is going to be the India component of CEPI, and we hope through this we would be able to partner for addressing a large number of global challenges, but also providing huge leadership to the regional countries in this. Thank you.
No, thank you very much, Dr. Swarup. A lot to be learned by examining that case study, which I think is fascinating for all of us. Commissioner Elfadil, you've explained to me what vast remit you have within social affairs over very many domains. So I'm sure many experiences that would be valuable to our Indian colleagues. You know, one issue that I've become aware of in India over the last few years are the increasing number of outbreaks of infectious diseases, whether it be Nipah, whether it be a number of unusual encephalitic syndromes, or Zika, or dengue. And I know that there's a lot of work ongoing to improve surveillance, detection, and response in India. But I've been tremendously impressed by the work you've done, and you've been a main driver around in terms of formulating this unique institution which had to arise very quickly, the CDC for Africa that is within your department. I wonder, you know, what experiences around that and lessons you think you might impart to us.
Thank you very much, Trevor, and I would like to start by thanking all the organizers for this very important meeting. And since most of you are technical people, researchers, I came here at 4 and listening to most of the presentations, I realized that most of the audience here are technical people from different fields of research and technology. I would like just to shed light that who are we, the African Union? And allow me to start by saying that the African Union is now the biggest intergovernmental organization that leads Africa. And the African Union came after we started, or the founding fathers started with the Organization for African Unity in 1963, which is being developed later to be the African Union in 1999, endorsed in 2000. The African Union powers and the African Union importance comes from the ability of the African Union to convene all the heads of states and governments of Africa in this same plenary hall, in this same Mandela Hall, which is named after Nelson Mandela, who's well known to everybody here. In this hall, we convene all our heads of states and governments to endorse, to adopt our continental frameworks, policies, strategies, and even sometimes to endorse if we want to go for piloting projects. So the convening power of the African Union, which reflects the political will of our heads of states and governments. This is why we are important as an African Union and an African Union Commission. And also these are on a rotational basis. The African Union is chaired by head of state, and the African Union Commission has an elected official, which is His Excellency Mousafaki Mohammed. We, as elected official, we are 10, 5 men, 5 women. We are leading the different departments with the chair and the deputy chair. Why I said this introduction before answering Trevor's question? Because for me, the whole conversation about Africa and the future of Africa, and I was trying to answer the question to myself, why Africa is most of the times at the receiving end of everything, and how are we going to change this current situation? It's by making sure that the leadership of Africa understand fully that Africa has a potential to become a leader. Africa has a potential to change the situation in Africa. This vision was enshrined in our Agenda 2063. Agenda 2063, it was also adopted as a continental strategic framework for Africa. And when we were celebrating the 50th birth of our OAU, we said that we need to plan for Africa. So the plan is a long-term plan. It talks about Africa in 2063. It talks about the future generations. And it talks about transformation. How are we going to transform Africa to have a future for these people of Africa, a better future? We have 7 aspirations. I'm not going to go into the details. But one of these aspirations is to have a well-being, a health and the well-being of all Africans, to maintain the health and well-being of all Africans. And there is also a details on how to do it. This is my introduction on answering why are we going for having our own institutions in Africa under the umbrella of the African Union. Because we realized that to do it, we need to have the capability and the capacity. When the Ebola outbreak hit hard some of our countries in West Africa, we realized at that time we have a very limited capacity to respond. It's not because we don't have the human resources. And I agree with my sister from Ethiopia, I don't know if she's still around. The minds are the same. We have intellectuals. But these intellectuals, most of them, because they don't have the environment, they migrate. They are working in different parts of the world. They are not working for Africa. So what we need is we need to create the environment in Africa that they can be useful to their continent. They can use the science they know. They can use their ability for innovating, for having new technologies, for introducing new innovations in Africa. This is what the African Union is doing. We are going a step forward by not just putting policies or adopting strategies, is by implementing institutions. And that's why we have Africa CDC. Africa Center for Disease Control and Prevention is a newborn institution. It was launched on the 31st of January 2017. But today, it is functioning, it is responding. It's in the RC, responding to Ebola. It was responding to meningitis, Lassa fever, all kinds of epidemics and outbreaks. We are working on malaria prevention. It's all over the continent. We still need to build our full capacity, but at least now we are on the right track by having this institution. We are building 5 regional collaborating centers, a center in each region in Africa. What we want in the future, we want to make sure that when there an outbreak happens, we don't respond from the headquarters in Addis Ababa. We will have the capacity on the regional level. The collaborating center will be able to respond. But not only that, we need to have the capacity on the national level to have a quick response, in time response, to save lives. We need to have the capacity on the national level. So the structure is very clear. We started with headquarters, going to the regional at the same time, and in the future, our plan is to build the capacity of the public health systems of Africa. I'm sorry if I'm taking long, but I just want to share with you that this area of disease outbreak and how to fight it is well taken care of. We are not doing it alone, of course. We have very committed partners. They are helping us, they are supporting us. Atlanta CDC, China CDC, countries, even Melinda Gates, they are helping and supporting. And every day there is new partners coming to support Africa to build its capacity. At the same time, our plan is to have our Africa Medicine Agency, which is a regulatory body. We have the agreement, countries started to sign. We are hoping that they will ratify and it will come into force in 2020. We need to make sure that Africa is not a dumping ground for falsified medicines, fake medicines. We have to make sure that our policies, pharmaceutical policies, is harmonized. We are aware of the risk. We are aware of the risks that created by not having the capacity to protect ourselves. So these, my remarks, just a few remarks without getting into details. I know some of you are very much aware of what I'm saying, but also for those who are not aware of what African Union is doing, what African Union is leading. African Union is working for making Africa a better place for its people.
Thank you very much, Commissioner Elfadil. And it is really a remarkable example. I haven't seen a health institution of such import put together with such alacrity to a functional state. So thank you very much. Well, let's turn our attention to another topic which has arisen and been talked about as a priority in this session. So I know that quite a few of the people over here are going to go up in a week to a meeting in Kigali, which is entitled Women Lift Health. And we had a remarkable panel here on Monday evening around this very same subject that I mentioned at the outset of the meeting, which is how can we in the health area take a more intentional gender lens to our work and thereby double the impact that we have. So I wanted to turn to you, Dr. Swarup, India first, in the sense of how have you been tackling the challenges that young women face in India in order for them to rise to the top ranks in the science and technology structures?
Rightly said, Trevor, this is in fact now a global challenge, and within India, where we have a huge workforce within the science group, it's important for us to bring in an ecosystem which can facilitate this. There are different aspects that we are looking at, and it's not just any one aspect of providing a training or a capacity building which can help the women empowerment, but it has to be a complete ecosystem. And I think that's really what the focus is. It's all bodies put together, whether it's the government, whether it's the private sector, whether it's organizations, academies and others who are working towards it to see how we can bring in this ecosystem. There are different components of it, of course, but I think the most important is a cultural and a mindset change which we need to bring in. And I think that is really where we are trying to focus and work on it. The whole science and technology arena, if you look at it, different fields of science have different challenges. In the biological sciences, we have more women who come in, but if you go into other fields of science, there are challenges there. From the government, we are putting in different policies, different systems in which we can promote it. The Ministry of Science and Technology, which I represent, has a special focus to try and see how we can provide re-entry career programs for women who actually have to take a break. And at that point, we've brought in special funding opportunities, special training and capacity building opportunities where we can bring women back into the mainstream. We also have different ways in which we partner with groups to do this capacity building exercise, as I said, through international partnerships. Our partnerships that we provide through the DBT Wellcome Trust Alliance, we also have a special focus of doing capacity building programs for women scientists. We also then want to look at opportunities in which we could encourage the young students to be able to get into the education field at earlier ages, and there we did find a gap in the engineering, the physical sciences, the mathematics area. So the government has actually put out different schemes in which we could provide special coaching and other opportunities to young girl students. And we have launched this very recently so that we can track the career of a girl child from the student to the doctoral and then the career advancement activities. But this is all about providing opportunities for their training and capacity building and education. But as I said, the ecosystem, the environment needs to change. And for that, it's very important that whatever we do, whether it's the policy making, whether it's looking at activities, and especially in terms of the global health, because we are talking on a global health forum, of their engagement at the community health workers, etc. Everything is done with the diversity viewpoint, looking at everything with the lens in which we can try and bring in this diversity component. So with that, we have special programs that we've structured in which we do empowerments at all levels. While we do it for the education, we are also looking at activities in which we are empowering the community workers, the health workers at the grassroots level. In the health sector, we are also looking at similar programs in which we are empowering the women agricultural farmers so that we could bring in empowerment at that level, so that a lot of decision making which is taken at the village level, at the grassroots level, we have the involvement and engagement of them. Of course, policies to have them participating, more participatory, more inclusive is part of the approach that we are adopting. And we hope through these initiatives that we take on, we will be able to bring in this. It's important not just to have numbers there, because I think while numbers are important, but it's important to bring in the merit and the capacity. And I think that's really where our focus is. How do we bring in an activity where we allow women to be able to find the leader within herself, because they are there, it's just that we're not being able to pull them out. So I think those initiatives are very important, where a woman can actually see herself as a leader and then be able to flourish forward. So I think that really is our focus, and it is a challenge. We've just started moving in that direction. It's going to be a while, but probably through the Women Lift and other such initiatives which happen globally, I'm sure we will be able to make a difference.
Thank you. Commissioner Elfadil, you've been a great champion of women's rights in Africa. Maybe your reflections on the challenges and some of the solutions you see to women and girls both accessing at the community level adequate health and also participating as active participants in delivery of healthcare.
Thank you very much. And I think what we are doing now at the African Union in the different departments, all of us, we are very much aware that women issues are cross-cutting issues, and women empowerment is a priority to all of us. We have a department responsible about human resource science and technology, and they are the one who are putting more focus on the younger generations, whether men or women. And they have designed many projects, especially on bringing in more women, more young men into the area of innovations by building their skills and give them the opportunities. And also by encouraging them, or especially encourage the young girls to be part of this movement towards building our capacity as African women, by building the capacity of the young girls, by making sure that we have projects that it will keep girls at school. They will not drop out, they will not be victims for early child marriage, they will not be victimized because they are living in impoverished places. So we have designed and we are implementing many projects in the different departments, and also there is leading projects in the Department of Gender, Women, Gender and Development. We are doing it together, very much aware that 60% of the population of this continent is young. And the percentage between girls and boys is, the difference is very limited, almost half-half when it comes to men and women or girls and boys. So we are being aware of these facts that we have in the continent. We put it as a priority that we have to make sure that the parity between men and women, it will become a reality very soon in Africa. We started with ourselves on the African Union. We took it from the highest level of the politically elected officials. We are going down in the different structures of the African Union. But we keep on advocating all over Africa with our member states that women should be given an opportunity to play their full role. And also empowering the women in the health sector, because also when it comes to the health sector, we found out that women are less. When you go to science and technology and the innovations, you will find the numbers of women are getting less and less. So we need to make sure that we will have specific projects that will work on filling the gap, on making sure that women can come on board, they will be encouraged, they will be given the opportunity, they will be given the training that needed so that they can come. And I don't want to name names, but I know that we have women in Africa who has been excelling in their fields, in science, in technology, and they are becoming a role model for our young girls in Africa. We ourselves in the Department of Social Affairs, we have started a very small project with UN Women and with ITU. It calls African Girls Can Code. And we targeted the girls aged 17 to 20, that we want to make sure that we are going to give these girls an opportunity to be skilled in IT, to be also given the opportunity to, if they have more talent in this field, to come out. We started with one camp last year, with participation from around 32 member states. Then we did it again in the SADC region. Then we did it for the third time here in Ethiopia, and the number is very large. When we did it here in Ethiopia, we brought girls from the different regions of Ethiopia, around 300 girls. Believe me, I was here also in this room 3 weeks ago with the chairperson and also with the president of Finland. These girls were amazing. These girls, they are for the first time being introduced to using computers, to have a laptop. But when we came around to see their ideas, the ideas came out of these young girls. It was really amazing. For my generation, it was difficult to understand how they got it, how they got it very quickly. They are very smart. All they need is just they need an opportunity. They just need an opportunity. They are putting solutions for everything, for water irrigation, for sanitation, for health project awareness. They are really amazing. But for me, they show me that the girls in Africa are no different from any girls around the world. We just need to make sure that they will be given the equal opportunities. They need to be protected from child marriage. They need to be protected from harmful practices that we still have in some of our member states. They need to be given the equal opportunities with the boys in the society. So I think what we do as African Union in our different projects to make sure that women are empowered, but also we are not doing it without the men. We always call for the men to be participant, that we need you on board. We cannot empower women by women. We need to empower women, but we need the whole society to be part of this empowerment process.
Thank you very much, Commissioner. And now we come to that time when we talk about the future and about next year. So I wonder, Dr. Swarup, can you give us a little teaser of what can we expect in Delhi next year?
Thank you, Trevor. And first of all, let me tell you how excited we are to have the Grand Challenges in India next year. We really look forward to it. We are looking forward to it not just to be partnering with the foundation as the host, the Government of India, but more importantly because of the partnership that we have had with the Grand Challenges over so many years. This partnership has been a very exciting partnership. It's been a journey which has taken discovery through translation to implementation, and we hope that in India next year we will continue this conversation. I can just say that a lot of excitement has been come up through various of these Grand Challenges meeting. This meeting in particular has had many exciting conversations, which are just the beginning. The last few spotlight talks that you heard were such exciting talks, which I'm sure we would love to see them being continued into the conversation. This whole conversation about the South-South cooperation, there is so much of importance, so much of strength in this partnership. And I think hosting the Grand Challenges in 2020 in India is going to be wonderful to take forward this conversation. So far, we've been looking at huge partnerships that we've had with the developed world, but I think now working with the developing countries, looking at the leadership that's going to come up is really going to be what we are looking at. I'm also pleased to let you know that in conjunction with the Grand Challenges Canada, we've agreed to have the Women Left for Global Health next year, and that is going to be very, very exciting. So we look forward to having all of you all there to take forward the conversation we've just had, the women empowerment, trying to see how we engage with them, and that's going to be a natural flow into the Grand Challenges where we will have a lot of the science being discussed. I can only say India would be very, very exciting, not just for the Grand Challenges. It's a wonderful time to be in India. October is the best month, the weather in Delhi. We look forward to seeing all of you, and on behalf of Government of India, it's my pleasure to invite you there, and we look forward to seeing you there. Thank you. See you next year.
Thank you very much, Dr. Swarup, and I'd like to thank my two panelists over here for your very insightful reflections. So we come to reflect a little bit on this meeting. And I've had a number of discussions with many of you, people who've stopped me, and the one thing you've said to me, which resonates a lot, is that you have a feeling that the meeting really blends science with application, translation, and action. And in some ways, unlike some scientific convenings, which are legitimately focused on dissemination of knowledge and information, this is a meeting about what impact can this knowledge actually have. I had dinner with a group of young and middle career and more senior scientists last night, and my question to them was, well, what can we do to make the meeting better, if that's an aspect you like? And they had a number of suggestions with me, so we should never rest on our laurels, and we will take those suggestions into the next meeting with our partners in India. It remains then to thank a number of you, and this is somewhat easy for me because I'm splitting the thanking component of this meeting with our very good MC of the session, Kadest, so she will fill in any of the gaps and details. So our anchor partners, Grand Challenges Canada, the Wellcome Trust, USAID, our friends at the NIH for the highlighting this important collaboration around sickle cell and HIV, the African Academy of Sciences, and then our co-hosts over here in Africa, the Ministry of Health, Minister Amira and your staff, you've been wonderful. The African Union, you've really opened your halls to us and made us feel tremendously welcome over here. And we specifically wanted, as Kadest mentioned, to have this last session over here. So Commissioner Elfadil and your staff, thank you very much. Commissioner Agbo and her staff, thanks to her. And Chairperson Faki, who was represented by Commissioner that we heard from Mangana. So thanks to our co-hosts over here. And then I already mentioned Kadest, but Kadest, you and your team and the partners have done a fantastic job with this meeting. And really, I think it's been great bringing it back to Africa for the first time in 10 years. Fantastic. My congratulations to you. And then finally, to the audience over here, for your energy and your engagement. I saw a little bit of evidence of that energy on the dance floor at our event last night, and who says that scientists can't also have fun? But I know that you have diligently been working on those joint proposals, and I'm going to be delighted to be looking over those submissions in the next couple of months, and we will get back to you with those efforts that we've supported, and we'll be able to look at their progress at the next Grand Challenges meeting. So thank you for your participation.